Hello, and welcome to Arcadia University's BI327 Histology course, and we're doing the lecture series on connective tissue. And this is part 5, where we're actually going to get down to the nitty-gritty and talk about different connective tissue types. Now, if we take a look at the connective tissues, we're going to see connective tissue proper, so your basic generic connective tissues. And there are going to be 3 general categories of those. We're going to have the loose or areolar connective tissue, a dense connective tissue, and dense irregular or dense regular. So it's basically defined by kind of the types of fibers that are going to be present. There are also going to be some specialized connective tissues, adipose tissue like fat cells, cartilage and bone as examples of skeletal connective tissues, and we're also going to have blood. Blood is an example of a connective tissue because we've got the cells with extracellular material between them. In this case, in blood, we've got an extracellular fluid in the plasma of the blood. Now, if we take a look at the loose or areolar connective tissue, what we're going to see is relatively few fibers and many cells, very numerous cells. It's going to have abundant ground substance, so it's going to have a moderate viscosity, so it's going to be relatively flexible, but it's going to be still relatively delicate. And so what it means is it's going to be very easy for things to diffuse through this region. So it's flexible. It's got some strength, not a huge amount of strength, but it's enough strength to hold the organ and the region together. Very well vascularized, because generally you're going to see a loose connective tissue under areas. The most common location is going to be the lamina propria underneath an epithelia. And as you remember from the previous lectures, we talked about the epithelia as being avascular. We don't have blood vessels going up into the epithelia itself. And so if we're looking at the skin, we've got multiple cell layers thick, we need to have diffusion from the blood vessels within the lamina propria, within this loose connective tissue, getting up into these cells so that these materials, the oxygen, the nutrients, the waste materials can diffuse away to keep these cells alive. And so commonly find a loose connective tissue supporting the epithelia, but you'll also find it supporting other structures within the body, very commonly between muscles, find it around blood vessels themselves, larger blood vessels, as well as kind of scattered throughout the body. But again, the classic location is going to be the lamina propria underlying an epithelia. So, if you want to take a look at a section of skin, you'll see the kind of fine staining appearance of the loose connective tissue. And again, if you take a look at this, we've got the epithelia as a maximally keratinized stratified squamous epithelia to the top. Underlying that, we've got this very fine pinkish staining region, lots of nuclei throughout here, and this is going to be the loose connective tissue. Deeper to that, you can see a more coarse pink staining appearance. This is going to be a dense irregular connective tissue, which we'll talk about in a coming slide. But lamina propria, loose connective tissue directly underneath the epithelia. The next one we're going to talk about is a dense irregular connective tissue. So again, looking at it within the skin, but not directly underneath the epithelia, but further down, deeper within the skin. So what you're going to see is fewer cells. Most of the cells that are going to be present are going to be fibroblasts, where in the loose connective tissue we had a lot of migrating small lymphocytes. So you got relatively few cells. The cells you have are going to be fibroblasts. Less of the ground substance, and that's going to sound a little bit weird, that we're not going to have as many of the glycosaminoglycans, the proteoglycans, and all that stuff in there to draw fluids in. But basically what we're going to see is kind of what appears to be random arrangement of these denser, coarser collagen bundles, these denser, coarser kind of pink structures kind of weaving in and out throughout the tissue. And you can see that on the slide, on the image on the right-hand side of the slide, at that kind of bottom portion. You can see that kind of coarseness. And these are thick collagen bundles. And remember, collagen is very resistant to stress, very resistant to stretching. So it's going to be very strong. The nice thing about it is that in a dense, irregular connective tissue, this is woven together. So it's giving strength in many directions. So you can grab your skin and pull it in all kinds of different directions, and you're not going to damage it, because we got stress protection, strength protection in many different orientations because of this seemingly random woven appearance within this dense, irregular connective tissue because of those thick bundles of collagen. So commonly found in the dermis, the deeper regions of the skin, as well as a variety of organ capsules, the protective structure around organs within the body. Now, the next one we're going to look at, the next type of connective tissue, again, connective tissue proper, is going to be the dense regular connective tissue. So again, it's a dense connective tissue. So we've got fewer cells, fewer ground substance, but we're going to have lots and lots of fibers, and these fibers are going to be packed in. Now, as opposed to the dense irregular connective tissue, irregular because you have that random woven appearance. In the dense regular connective tissue, we got lots and lots of these collagen fibers packed in on one another, and essentially they're going to be running parallel to one another. And so if we think about this, very, very strong, resistant to stretching, but they're all running in the same direction. And so they're going to be very strong along that axis, along that direction. And so what we're going to be talking about are things like tendons and ligaments. And so they're going to be very good at transmitting mechanical force. You've got the tendons and the muscles in your arms. You can contract your arms and you can lift the weight because those tendons are going to be very, very strong. You've got ligaments that are holding your bones in relationship to one another. Very, very strong as long as your bones are moving in the right direction. Now you go out on the soccer field and you're playing soccer and you get hit from the side and they push laterally on your knee and you're going to tear your ACL because your knee is great. You can squat, hundreds of pounds when you're moving in the right direction. You push at a slightly different orientation, slightly different axis. The connective tissue, the dense regular connective tissue, the tendons, isn't oriented along this axis and it's relatively weak. And so you can have damage and tearing occurring. So very, very strong along the axis, but susceptible to stresses coming in from another direction. Dense regular connective tissue, again, the cells that are present are going to be fibroblasts, fewer ground substance, less ground substance than we would see in a loose connective tissue, but lots and lots of these collagen fibers all running parallel to one another. Most common location would be tendons and ligaments, but we're also going to find this within the cornea and certain organ capsules, and we'll talk about some examples of that as we go through the course. The next connective tissue we're going to look at is starting to get into a little bit specialized. We've got the reticular connective tissue. We've talked about this before. We've got the collagen matrix forming almost like this jungle gym or three-dimensional scaffold. Lots of cells are going to be present, relatively little ground substance. And so we're going to have the reticular cells that are establishing the matrix, essentially establishing the fibrous matrix, the jungle gym. But primarily lots of lymphocytes or lots of blood-forming cells. They're going to be migrating through this region. So we're going to have lots of motile cells, often filtering body fluids through it. And so what we're going to see is that reticular connective tissue is going to be found in areas like the bone marrow, the stroma of the spleen. We can find it in lymph nodes, locations of the body like that where we need these characteristics. The elastic connective tissue we've talked about a little bit before. Fibers are going to be predominant, but they're going to be more elastic fibers with some collagen for strength, but primarily you want to have this kind of flexible structure. Some fibroblasts are going to be present, again, because they're going to be there to synthesize and maintain the components of the connective tissue. Now, when you take a look at an elastic connective tissue under normal hemotoxin eosin staining, it's going to look like a dense, regular connective tissue. It's going to look, in essence, like a tendon. But what's going to happen is you're going to have elastic fibers that are going to be present there within kind of a thick, wavy pattern running parallel to one another. So running in the same way we'd expect within a tendon. But without an elastic fiber stain, you're not going to be able to see them and you're not going to be able to discriminate an elastic connective tissue from a dense regular connective tissue. Examples of where you'd find that would be the ligamenta flava of the vertebral column and things like the suspensory ligament of the penis. Now that's it for the connective tissue propers. We're going to talk in the next couple lectures about some specialized connective tissues, namely cartilage and bone. If you have any questions, feel free to email me at hoffmanj@arcadia.edu, and hopefully you'll continue on to the next set of lectures. Thank you.